Okay, hello everyone. Good morning, good afternoon, wherever you're joining us from around the world. Thanks a lot for joining us, and we hope you're all doing well and keeping safe during these uncertain times. Our thanks today for helping us with this session, the Australian Embassy in Austrade. I'm James Scullin from the Australia-China Business Council. Now, we definitely have a lot to get through today. But before we begin, I'd just like to let you know that unfortunately Professor Sharon Lewin is unable to join us for today's session. However, we have Professor Peter Doherty himself joining us from the Doherty Institute, who will provide an update on the virus itself. We'll also be crossing to Beijing to speak with Austrade General Manager Daniel Boyer to get a sense of how the virus is impacting business on the ground in China. We'll also cross to Sydney to speak with Jenny West, who is the General Manager for Trade and Investment at Austrade, to see how business in Australia is being impacted by the coronavirus. Now, before I pass you on to ACBC National President David Olsson, just a few housekeeping matters. We do have a few hundred people on the call today, so should there be any issues with bandwidth or the feed at all, rest assured this session is being recorded and will be posted to the ACBC and Austrade websites early next week. We'll also be taking questions. So you have a text box on your screen there. All attendees are muted, but if you have any questions, please let me know in the text box, and I'll endeavour to get around to as many of those as we can before we finish at 2 o'clock Australian Eastern Daylight Time. Okay, well, that's enough from me, and I'd now like to pass you on to ACBC National President David Olsson. Over to you, David.
Thank you, James, and hello to everyone joining this webinar. We're certainly facing many global challenges right now, but if there's really one positive we can take from this right now, it's the way in which governments, business industry, and the community as a whole are really coming together and responding. And today's webinar really is a great demonstration of that spirit of collaboration. So I thank all our partners in this discussion today, and I thank all of you people joining on the webinar, especially the members of the ACBC. The ACBC has been right at the heart of this in Australia for some time now, but I'd also like to give a special shout out to our colleagues at the AusChams in Shanghai and Beijing for all the work they're doing, and I know they've run a couple of really good webinars in recent weeks. So it's my pleasure to make a few comments about the business impacts of COVID-19, and particularly to talk about how the ACBC is responding, and I'll address our current focus and our priorities going forward. Today is the 20th of March 2020. We're not yet into the third month, of the new decade. None of us could have envisaged the events that have taken place in that short time. When we greeted 2020, we were experiencing one of Australia's worst ever bushfire seasons, but the outlook was broadly positive. The Australian stock market was at a record high. The ASX had just gone through 7,000 points for the first time ever. Retail sales, unemployment, inflation all came on stronger than expected. As we moved into the year, we became aware of the new coronavirus emerging in Wuhan, and by early February, around the time of the Chinese New Year celebrations, it became clear that this was becoming a major medical and humanitarian issue. With over 60 million people in full lockdown in Wuhan and many cities across China, we were all concerned for those directly affected by the outbreak and could see that it would disrupt supply chains and investments for some time. ACBC was right at the forefront in showing our concern for our friends, colleagues, and loved ones in China. And up on the screen at the moment, you'll see a national advertising campaign which we launched. Its message was simple and clear. As friends, we support each other and we stand with China. The campaign was a full-page advertisement in the Australian newspaper. It was supported by businesses and government across Australia. It was projected onto iconic landmarks around the country and appeared on billboards at the Melbourne airport for 1 month. It was also posted on Australian and Chinese social media. We received literally hundreds of expressions of thanks from Chinese individuals, organisations, including personal messages from the Chinese Embassy in Australia and CCPIT chairman in Beijing. China, thankfully, is now showing positive signs that COVID-19 is coming under control. but the challenge is now a global one. The foremost priority for Australia is about protecting our communities, ensuring that they have access to medical treatment. We'll hear more about this shortly from Professor Doherty. The other priority is around protecting our economy. In Australia and globally, central banks and governments are implementing extraordinary measures to support the financial markets and the economy to maintain jobs. And at the front line, organisations such as Austrade are working directly with Australian companies to help them through this difficult time. We hope all these policies and initiatives will work to stabilise the economies and to rebuild confidence. What none of us know at this point is when the recovery will start. The Reserve Bank talked about a rebound in the second half of this year. Hopefully they're right, but it could be later. Either way, it's important to remember that the rebound will happen. We will recover. People will go back to restaurants. People will go back to football games, and things will bounce back. But it won't be business as usual. Markets will change. Supply chains will be reconfigured. Competition will change. The labour market will change. The consequence is that we'll all need to radically change almost everything we do. How we work, which we're evidencing right now, how we shop, how we manage our healthcare, how we educate our kids, take care of family members, and importantly, how we engage in cross-border trade and investment. Technology, big data, new distribution channels, especially e-commerce, new forms of finance will all become more important. This is going to be a big challenge for some companies, and some will fail. But for many, it's a time to explore new growth opportunities. Just this morning, I was talking to the Vice Chancellor of one of our major universities about its move to remote online teaching. He said that the task was a massive one, but the upside that it's forcing a change to the university's business model, forcing it to invest in technologies that would otherwise have taken many years. That's important for Australia, but it's also good for China. If we continue to educate China's next generation, it will help China avoid the middle income trap and remain one of the growth engines of the global economy, which is clearly in our national interest. The current situation is also causing some to consider whether Australia is trading too much with China and too dependent upon the Chinese economy. My personal view is that we should not shy away from acknowledging the importance of the China relationship to Australia. I understand the need to diversify markets, but that really is a matter for companies and the markets to address, having regard to risks. I do not believe we should be implementing formal policies to reduce trade with China by impeding exports and imports, or by intervening in the market by specifically diverting trade away from China. The fact is that as China moves out of this COVID-19 shock, which it is doing, it will continue its economic transition and become even more important. Instead of intervening in the market to reduce trade with China, a better strategy is to manage our highly interdependent economic relationships and the inevitable shocks that will arise from time to time. We need strategies going forward that will strengthen the macroeconomic framework and tools at home, while continuing to engage China and the global system in protecting openness, rules, and engagement. So where does ACBC fit into all of this? At the start of the year, our focus was on the humanitarian aspects of the virus breakout in China. Led by our national CEO, Helen Sorchak, we harnessed the networks and connections of our members across the country to source gowns, masks, and surgical equipment. We worked closely with the Chinese embassy and consulates to coordinate these supplies going to China. Our number one priority has been and continues to be the health and well-being of the community. We'll continue to monitor closely the evolving situation and follow the advice of the federal and state governments and health authorities. We have deferred all face-to-face events that are scheduled up until September and October. Most staff are working away from home for this period. We're committed to supporting our members and the broader business community through this period, including with targeted resources, not just COVID-19 related, but by helping members to assess the implications for their organisations and to chart their path to recovery. We'll continue to operate remotely through our branches across the country. Meetings and committees will run remotely, and our team is focused on delivering valuable services to members, particularly through webinars such as this. And James will mention later on some of the more specific and exciting programs that we'll be rolling out. But I'd like to mention that you should stay tuned for some online new training programs tailored specifically to the needs of regional firms that are looking to capitalise on inbound tourism, education and investment. If you're not already a subscriber to our blogs and our monthly China Path podcasts, I recommend that you do so. The blogs provide timely summaries of key issues, and the blogs and the podcasts are fascinating interviews by James with leaders in industry, arts and the government in Australia and China. We'll be launching in May a new website which will provide even greater sources of information for our members, particularly those in our member-only section, which will contain full access to our thought leadership reports, our webinar recordings, and other material. If you want more or things done differently, now is the time to tell us. Our annual member survey was released a few weeks ago. It's still open and you still have time to respond. So I'd urge you to do so as soon as you can if you have not done so already. To wrap up, the year ahead for ACBC, like everyone, will be a challenging year. We're moving from managing the initial stages of the COVID-19 shock to a far greater focus on the next phase, recovery. We're developing new plans, new ways of doing things, which will be largely technologically based, but all designed to help our members with information and skills which will help you find the answers to the critical questions we're all facing and to deliver strategies, ideas and solutions to get you back into growth. Thank you.
Thank you, David. It's now my privilege. Thank you, David. It's now my privilege to be able to welcome former Australian of the Year and Nobel Prize winner, Peter Doherty. Peter, thanks a lot for joining us today. Can we just get a sense to start off, Peter, how much do we know about the virus itself at the moment with regards to its reach and who it affects?
We know a great deal about it because we've known about this virus for several months. We know that it's gone global rapidly, that it spreads quickly, that it spreads at least as easily as influenza and possibly more rapidly. It's got what we call an R0 of at least 2.5. That means any one individual will infect 2.5 or 3 more people, and possibly higher than that, and certainly higher if we go into crowded conditions. So we understand what sort of virus it is. It's part of the same family as the SARS coronavirus and the MERS coronavirus. We understand that it's probably come across to the human family through bats, transmitting to some other species and then to humans, and it's more transmissible than either the SARS virus or the MERS virus, though less severe. Still, it is very severe. It's particularly impacting on the elderly, but even though we consider, largely from the Chinese data, that 80% of people will have a relatively mild infection, it is still possible to get very severe infections in younger people, even into children, though children seem to be relatively unaffected.
Okay. Well, thinking about the pandemic...
And as far as we know, it's now pretty much everywhere.
So thinking about that pandemic extent of the virus at the moment, to what extent does the virus and the impact need to get worse before it gets better and we start to see some type of recovery?
The impact of the virus that we're concerned about in the context we're talking here, of course, is how long it will disrupt normal society. And we can't really tell how long that will be. Talk about getting worse, what you're really saying is how many more people will get it. What will be the dynamics of this pandemic in different societies. And as we've seen, China dealt with it extremely aggressively and decisively, and it's now, as I understand it, often in many ways back to normal. But we're just looking at the beginning of that phase. We're at a phase in Australia where there is just minimal community transmission, still at a very, very low level, but we expect that will ramp up. And unfortunately, the best medical option is to try and flatten that peak. That is to say that we want to try to get not an extraordinarily high level of transmission, because that will overwhelm our medical facilities. It will overwhelm our critical care beds and, of course, and our capacity to use ventilation and all the rest of it. So if we can flatten that out, we can deal with it much better medically. On the other hand, the more we flatten it out, the longer it will go on from the economic aspect. Eventually, we will get to a stage where a large proportion of the population, 50, 60% even, has had the infection. They're immune. Transmission will fall. And of course, all those people who've had the infection and are clinically well can now go back to normal activities.
So compared to other countries around the world, how well placed would you say the Australian health system is to deal with the curve as it is with regards to testing kits and beds and hospitals?
Fortunately, with respect to our level of preparedness, we've been able to buy some time. We've been able to buy some time and keep it out of the country to a substantial extent, though we have cases here and we're now having some community spread. That has allowed us to get things up and online. For instance, our testing capacity, really of high quality, but quite limited in extent. And it's been rolled out in Victoria, for instance, from our institution. We've now rolled out many other labs so that the numbers of tests that can be done are greatly increased. And we're dependent on us because our people were getting, even at this early stage, rather exhausted. We're also looking at strategies and just beginning to do this of pooling samples. So we test a pool of 8. And then we go back if that pool's positive and we retest the individuals. Now that increases the number of tests we can do by a factor of 8-fold, but it requires a lot of care at the laboratory level and people are being trained up to do that. We are not as well prepared as, say, Singapore. And the reason for that is basically, apart from any differences in the two societies, that Singapore had a very bad time with SARS. They missed it to begin with. They had a difficult period. And then they had also the MERS, the Middle Eastern virus, that was similar. So Singapore was all ready to go. It had all the public health and public service modalities in place to really deal with something like that. And though we talked about this in Australia back with the bird flu scare and with swine flu, the threat was never of this magnitude. So it's taken us some time to build capacity and pull things together. But the country has been working together extremely well. The federal government has been providing good leadership. They're listening to the chief medical officer, and our professionals in epidemiology, public health and so forth are feeding into the chief medical officer. So I think we're doing reasonably well, as well as can be expected, of course, but no medical system has the excess capacity to deal with something like this. It's just not economically feasible to build into any medical system.
Thinking of testing kits, what's the procurement process for these testing kits? Where do they come from? Because we have a lot of ACBC members who are in the health sector and have contributed greatly to the situation in China and would like to play a greater role. Is there some insight you can give into where the kits come from and how they're procured?
Yeah, can't answer that in detail because I'm not involved in that. I know a lot of it's coming from Roche, Qiagen, different companies around the world. And we're also making kits of our test kits of our own. It's a global issue, and all countries are trying to access this material. So we're in as good a shape as anybody else. And quite frankly, we've done as much testing as everybody else in the sense of testing the community. We do know that at the moment, as of last Tuesday, for instance, we were testing a number of people in Victoria. These were people who were what we call the worried well, coming into the doctors, or various types of respiratory infections, or people who were referred to the testing service by their doctors because they thought it might be COVID-19. They were traveling or something of that sort. We do know that as of last Tuesday, only 1% of those people who were showing potential symptoms were testing as positive. So it's been quite low in the community. We also understand that in the United States, they missed it early on and it was going for some weeks because they were having a problem with their tests.
So we represent Australian and Chinese firms around the world, and there's often some cultural differences between how the effectiveness of face masks are seen. I understand that the Chinese government heavily recommends face masks to be worn, but the message in Australia is not so harsh. How effective are face masks, and is that something that you recommend people should be wearing now?
Again, it's a debated issue. Where face masks have generally been thought to be of some value is if people are actually infected, to present others being infected. A very good piece of advice, in fact, that I saw, I picked it up on Twitter of that great authoritative source, but is to think in terms, as you go around the community, think in terms of the fact that you actually have the infection and you don't want to transmit it to anyone else. That will actually make you behave much better to protect yourself, because you will behave and you'll be conscious all the time of the possibility of transmission. Face masks, it's more complicated than that. Firstly, we have the availability question. Face masks are only now starting to become available in, say, our pharmacies. But I've seen the ones that are there, and they're not particularly wonderful. So they may give you a certain cosmetic comfort, whether they would be much of protection or not. The N95 type masks, I think they're being pretty much reserved for medical personnel. One of the main things we have to do is protect our medical personnel. I don't see any harm in wearing a face mask, but don't be too reliant on it. The main thing to be reliant on is maintaining social distance as much as you can, 1.5 meters, and also keeping your hands clean, hand washing or using hand sanitizers and so forth, because of the problem that we all have, that we all put our hands to the face all the time. And this is always a big factor in respiratory infections.
You mentioned the situation in China earlier. I saw recently on Chinese media some celebratory scenes of nurses and doctors leaving the epicenter in Wuhan. To what extent is the virus taken care of in China at the moment? And is there a danger of a second wave of the virus?
Look, I think there's a danger of a second wave. In fact, I mean, our thinking is that we may have sort of peaks and troughs. That's quite possible we'll have that happen. It depends how the epidemiologists do the modelling, but you can model for various situations, and it really depends on how fast this kicks off and how wide it spreads. So, really say with any certainty. Of course, China is always at risk of reintroduction, or that it may be grumbling away somewhere else, but I think they would pick it up quickly. And of course, now you have a highly centralised with a very well-organised task force who would respond extremely quickly. So I think if you had to, if for instance they got another instance, like the initial Wuhan one, now the horsepower or the manpower and person power that was brought onto that would be such that it would be limited fairly quickly.
And what can Australia learn from China's response in the way China has handled the virus?
Well, I guess we're a different type of country from China, but we're progressing towards, or we have, as I understand it, and I'm not involved at the policy level, that's way above my pay grade. I'm down in the lab and or the lab environment, because they no longer let me in the lab anymore. I'm too old and too inefficient. But they, as I understand it, our response is graded. And of course, we have all learned from the China. And the more we can delay severe disease here, the more useful that experience will be. So China responded massively and very, very quickly. No other country has been able to do that on that level, except perhaps for Singapore, which of course is a pretty small place and a very small geographic location as well.
Would you say that travel bans are effective in the pandemic?
For the moment, I'd say the travel ban with the coronavirus is some of what we're doing is sound. Once it really ramps up, I'm not quite sure what the travel ban achieves for us, except for not having more people come who are going to get sick. But that will have been thought through, I think, very carefully by the public health people. It's not really a question I can answer. I think the travel ban for New Zealand should be great. I mean, New Zealand is an island. They've got very few cases so far, and I don't think they've got any community transmission. They've only had cases of people who've come in from overseas. So New Zealand might do very well with locking it up. We also have the same potential here with Tasmania. But there will become a point where travel bans will not stop the pandemic in any sense whatsoever. They'll neither add to it nor diminish it. So that's a question for government, quite frankly.
Okay, great. Well, just one final question, Peter, before we move on to another speaker. Where does the coronavirus, how do you see it in terms of your career? You've been in the game a long time. You've obviously, seen lots of viruses come and go. Where does COVID-19 sit?
Well, from my point of view, I've been working on infection and immunity now for more than 50 years. I've been on task forces for the US government. I worked a long time in the United States. So we looked at various diseases. And for the last 30 years or so, I focused mainly on influenza. And so we always compare everything back to the 1918-19 influenza pandemic. And quite frankly, this looks in many respects to be somewhat parallel. The difference is 1918-19, there was a big peak in very fit. So a lot of young soldiers, for instance, died. And we're not seeing that. It really is targeting the elderly, which influenza normally does. Influenza normally targets the very young and the very old, where we're not seeing much in the very young, thankfully. And we think most younger people will be okay. And they may feel pretty lousy for a while, and some will die, but not lots of them. So it's most similar to the 1918 pandemic. I should tell you something. In 1918-19, the state of the science was such that the first influenza virus that was ever isolated anywhere wasn't isolated until 1931. So it was 12 years, and it was more before we isolated them from humans. Now, of course, we're immediately onto it. The science is fantastic. Most of the issues with respect to time to get a vaccine out are really to do with safety and efficacy testing. It's not the technology that's the problem. It's just the human factors and the time it takes to get these things done. Our science is incredible. We will be through this, and I expect we'll be through it, but it may take 6 months. It may take 18 months. We really don't know. And once we're through it, I think if we see this virus hanging around, it'll be much more likely because it'll be operating on a background of prior immunity, full immunity or partial immunity, we don't know. But it will settle down.
Well, he's hoping so. Professor Doherty, thanks a lot for your time. And keep those questions coming in, and I'll try and ask you some questions toward the end of the session. Thanks, Peter. Now, to get in some insight from China on the ground in Beijing, we'll now cross to Austrade General Manager for Greater China, Daniel Boyer. Over to you, Daniel.
Thanks very much, James. So, as James said, I look after Austrade's Greater China network that comprises about 100 staff across 9 offices in mainland China, Hong Kong and Taipei. Today, I just wanted to touch on the general situation here in terms of numbers and health, how Austrade is operating in China at the moment quickly, and some of the core business trends and impacts in China, especially around how China is heading back to work, ports and logistics issues, and some interesting early data on consumer behaviour as well. I won't go into specific sectoral impacts in any great detail, but I'm very happy to take questions on these and also encourage any of you with a particular interest to reach out to me or the rest of the Austrade team here. Finally, I want to stick my neck out and do a bit of crystal ball gazing. What does all this mean in the long term in terms of trends and issues in China? In terms of our health and the numbers here, things are moving, as Professor Doherty said, incredibly quickly. It was only a few short weeks ago that China had more than 98% of COVID-19 cases worldwide, and now it's under a third. Critically, the number of active cases has fallen from more than 60,000 4 weeks ago to less than 8,000 now. Seen significant drops in daily increases in cases, including in Hubei province, who have recorded for the second straight day 0 cases. Less than 30 new cases a day across mainland China for the last 2 weeks, and almost all of these are imported cases rather than community transmission. Particularly if large numbers of expat Chinese return to China because they feel that the situation here is probably safer than some of the countries that they're in overseas. The focus of the government here has shifted to increasingly draconian control measures for international arrivals here, and particularly in Beijing, and perhaps more importantly towards economic recovery. In terms of our staffing arrangements here for Austrade, the government decided to draw down embassy staffing levels at the beginning of February, and all non-essential staff had to return to Australia and all of their dependents as well, including my family. From Austrade's perspective, that left us with 4 what we call A-based staff at post. Liao Bing in Shanghai, Tim White in Chengdu, Dane Richmond in Guangzhou, and myself in Beijing. The rest of my team are back in Australia, out of quarantine and working in Austrade's offices, although we are now looking increasingly at home-based work in Australia as well, of course. As China relaxes its interprovincial travel restrictions and slowly gets back to work, more of our local staff have been able to return to the office. We're now at about 90% staff back across mainland China and Hong Kong, and Taiwan was business as usual, although a little recent spike that might see us sort of heading in a different direction over the next week or two. The most important message for you to take out of that is that we're here, we're working, and you can get in contact with us at any stage. So what about the rest of the country? Are they getting back to work? We're seeing some encouraging signs despite troubling January, February economic data. China's National Bureau of Statistics released data earlier this week which showed a double-digit decline across all key economic indicators for January and February, the worst monthly economic data on record. For example, retail sales were down 20.5%. The national unemployment rate rose to 6.2% in February, up from 5.3% in January. Again, the biggest one-month jump on record. Beyond these broader economic indicators, some high-frequency data such as power consumption and domestic passenger numbers suggest that companies are returning closer to normal, or at least what we might call the new normal. The China Economic Recovery Index, compiled by WeBank and based on aggregated mobility data, suggests that around 2/3 of business activities, including manufacturing and consumption, had resumed as of last week. And there's a sharp distinction emerging, though, between large manufacturing enterprises on one hand and China's small and medium-sized enterprises on the other. Ping An Bank estimated that the average return rate across the country of its small business clients was 47.3% this week, up from 8% 2 weeks ago, a major improvement, but still far short of the 80 to 90% resumption rates recorded in SOEs and large manufacturing firms. Government support is also differential. The largest employing and tax-paying companies and some critical supply chain companies are getting support from government to reopen in the form of subsidised transport for returning migrant workers, tax and social security breaks, and fast-track government approvals. The picture is less positive for SMEs. Excessive government regulation, slowness and inconsistency of rental reduction, tax concession schemes in some provinces has added to the significant demand shocks already experienced. A recent business survey in Guangzhou, for example, suggested 25% of all restaurants in the city would close permanently. Finally, Morgan Stanley reckons about 2/3 of China's 300 million migrant workers have returned to work in the week of 9th of March. Interestingly, we're hearing some reports from Chinese authorities are using the opportunity to encourage some of China's massive pool of migrant workers to remain in their hometown or get work closer to home, with a focus on boosting employment numbers in the services economy in those areas, and to reduce pressure on eastern seaboard cities' infrastructure. In terms of logistics, ports are close to normal, but travel restrictions are still creating some challenges for distribution. The China Port Association reported that with the exception of Hubei, ports in China this week have now all returned to close to normal operations. That's about 90+% capacity, which is generally consistent with feedback that we have received from most distributors and major exporters here. The number of reefer containers, for example, in Shanghai and Tianjin ports have reduced from a peak of 27,000 in the week of 15 Feb to 17,000 in the week of 6 of March. Storage capacity has increased by 40% in both ports as well, and there is no shortage of reefer plugs, which was a significant issue about 4 weeks ago. There are still issues with drivers and travel restrictions. Our best estimates suggest that 65% of export container truck drivers are back at work, although in Shanghai it's as high as about 85%. While ports may be close to fully operational, it will obviously take some time for the build-up of containers in China that occurred throughout February to wash through the system. We've heard from some exporters that they're facing a shortage of ships and containers at the Australian end to get product to market. The impact of the COVID-19 spread on other related markets is also unknown at this stage, and we'll obviously watch that closely in the coming weeks. The implementation of travel restrictions over the previous couple of months has seen a substantial uptick in parcel traffic into China, interestingly. Customs and authorities in Zhejiang province saw an increase of around 700% in parcel traffic year on year in February, while Australia Post reported a 243% increase in parcels into China over the same period. Some of this is likely to be the importation or re-importation of medical products and supplies, but the significant increase is also potentially showing a shift away from suitcase Daigou trade, which has been made impossible. While ports may be close to fully operational, it will obviously take some time for the build-up of containers in China that occurred throughout February to wash through the system. We've heard from some exporters that they're facing a shortage of ships and containers at the Australian end to get product to market. The impact of the COVID-19 spread on other related markets is also unknown at this stage, and we'll obviously watch that closely in the coming weeks. The implementation of travel restrictions over the previous couple of months has seen a substantial uptick in parcel traffic into China, interestingly. Customs and authorities in Zhejiang province saw an increase of around 700% in parcel traffic year on year in February, while Australia Post reported a 243% increase in parcels into China over the same period. Some of this is likely to be the importation or re-importation of medical products and supplies, but the significant increase is also potentially showing a shift away from suitcase Daigou trade, which has been made impossible, of course, by the border restrictions that countries have applied, and particularly mainland China, to parcel Daigou trade. In terms of consumer behaviour, we're expecting, and we're seeing, in fact, another boost for e-commerce, just like SARS. So if you look at SARS, there's some early indications this time around that China's consumers will continue to embrace e-commerce with renewed passion. During SARS in 2003, JD.com was launched and Taobao wasn't far behind, which altered China's retail landscape forever. Now e-commerce platforms are reporting behavioural and demographic shifts. During Spring Festival, daily usage of e-commerce platforms grew by 56% week on week, and that's not off a low base. 2 weeks later, it was up a further 96%. People over 40 years of age have ordered fresh food online in far greater numbers due to restrictions on movement. Middle-aged users and above grew 237% on the Miss Fresh platform, for example. Taobao's live streaming sales during International Women's Day, which is known as 38 Queens Day here and is a large online shopping day, rose by more than 250%, while at the same time more than 90% of Tmall merchants have resumed work, and Taobao had 1 million new merchants join the platform in February. Alibaba has reported that its parcel and meal delivery services are back to pre-outbreak levels, and perhaps even more incredibly, JD.com is forecasting 10% revenue growth in Q1 of 2020. Beyond e-commerce, in the 3 weeks following 14 January, China's online netizens' usage grew over 20% to 6.11 billion hours. That's over 6 hours per Chinese online. Time was spent on consuming short videos and news info and playing games, interestingly enough, and a huge potential new sector for Australia to break into. As I say, I won't get into too much detail on individual sectors given that we don't have too much time. However, I would say that some sectors are feeling the hit a lot harder than others. On the Chinese side, the most affected sectors are hospitality, travel, retail, and property. Insolvency rates are always really hard to pin down in Chinese economic reporting, but anecdotally, we're hearing that a lot of SMEs in these sectors have already gone or will be going out of business. On the Australian side, the hospitality sector falling off a cliff here has obviously had significant impacts on some of our food and beverage exports, seafood in particular. For example, the price of lobster fell from pre-Chinese New Year highs of about $130 a kilo to $50 or so in mid-February, and has only partially recovered to about $80 a kilo now. We've seen similar challenges for fresh dairy, although other food exports, red meat for example, have held up well, all things considered. Likewise, our commodities exports, although affected, have held up pretty well. LNG shipments to China in the first 2 weeks of March are on par with the same period last year, while China Iron and Steel Association expects China's annual steel consumption will drop by only 0.5% in line with market forecast before COVID-19 hit. So what does all of this mean in terms of trends? It's really, really hard to tell because things are moving so quickly. The profound hit to demand may change consumer behaviour in some areas. It is likely, though, that many sectors will bounce back. It's just a question of how quickly and to what extent, and on how much of a global recession blows back on the Chinese economy and further impacts demand. Most importantly, if the Chinese middle class takes a significant hit, that will drive down demand for many of our premium exports, from wine to supplements, to beef, to dairy, to education, to tourism. Aside from that sort of general comment, if I had to put my reputation against a few predictions for potential medium to long-term shifts, there are a couple of possibilities. The significant short-term hit to hospitality will likely drive smaller SMEs out of the sector, opening up opportunities for chains and franchises here in a more meaningful way. It will definitely drive more people into e-commerce, consumers and businesses, and this won't just be a China thing anymore. This will be global. Businesses should engage with e-commerce and the inextricably linked social media marketing meaningfully and quickly. It sounds cynical, but there are obviously significant opportunities in the health sector now and into the future. Pharmaceuticals, research cooperation, supplements, medical devices, e-health, etc. On e-health, interestingly, Ali Health app, again not off a low base, saw a 7,000% increase in users over COVID-19 period in February in particular. And finally, we're already hearing about the Chinese infrastructure spending to pump stimulus into the economy. I don't anticipate that this is going to be on the same levels as 2008. They're concerned about creating something of a debt bomb in the same way that they did in 2008, but you can expect that provincial governments will push for some of that infrastructure spending, which will have some positive impacts on our commodity exports, particularly iron ore and other minerals. And James, I might leave it there.
Thanks, Daniel. It's obviously such a fluid situation, and we really appreciate Austrade and the Australian Embassy keeping their fingers on the pulse in Beijing. There was a lot of information in that. Just a reminder that we'll be posting this webinar to the ACBC and Austrade websites next week if there was anything that anyone missed there. Okay, so now we're going to cross to Sydney with Austrade General Manager for Trade and Investment, Jenny West, to get a clearer picture of how this is impacting business back home here in Australia. Over to you, Jenny.
Thanks, James. It's my pleasure here today for the webinar, and thanks to ACBC for hosting. In my role, I look after the key sector teams across Australia and investment specialists for Austrade. As you've heard from Daniel in terms of what it's like on the ground in China, I'm here to share the insights on the evolving situation on the business impact in Australia. We're monitoring the situation very closely. Austrade has over 1,100 staff globally, so we're able to actually see the impacts that are happening on a country-by-country basis across the globe. Importantly, in Australia, we're having conversations daily across our client base and with partners in industry and providing up-to-date insights around what's happening on the ground for Australian businesses, and this is being fed back daily into government. As Daniel mentioned, it's changing daily, and so I'd like to share with you just two key sectors that have been most heavily impacted, and that's education and tourism. So in terms of the education sector, when the travel restrictions were put in place for students from China, over 100,000 Chinese students were still in China. Many had stayed longer due to the Chinese New Year. Since then, we estimate around 40,000 of these students have travelled to Australia via a third country, where they stayed for at least 14 days. Australian universities, as you've heard, have had to rapidly mobilise their online learning options for international students and domestic students as well. We've actually developed a guide for delivering online education in China and a referral list of technology solutions that providers can use to assist. This information is on the Resource Hub of the Study in Australia website, and we'll also be holding another webinar on this on the 26th of March to support the sector. The Department of Education, Skills and Employment and other agencies are regularly engaging with the Chinese government counterparts to discuss education issues, including support for and access to online education. One thing we're working through at the moment is that the Chinese Service Centre for Scholarly Exchange, who's responsible for the recognition of qualifications in China, does not currently recognise qualifications earned via cross-border distance learning. Online degrees, therefore, are not recognised. Beijing Post has sought clarification, and we're waiting feedback from the China Service Centre on their treatment of blended learning currently. More broadly, Australia's education sector is facing enormously challenges due to the recent announcements about the borders being closed to foreign nationals. For example, Australia's English language sector, which is an important contributor to tourism and a pipeline for further education and training, is entirely reliant on foreign nationals. In the tourism sector, again, we're experiencing unprecedented challenges following the bushfires and COVID-19. Australians are now experiencing some of the same uncertainty and worry that the Chinese people have been dealing with since January. Tourism is an important sector for the Australian economy, worth $152 billion, with over 1.3 million Chinese visitors per year. It indirectly and directly employs 1 in 13 Australians and accounts for 8% of Australian exports. Coverage of the bushfires had an immediate impact on forward bookings, and this, as well as the downturn in Chinese visitation of COVID-19, has had a significant impact on the sector. So health advice to physically distance as well amid the pandemic is further impacting the restaurant and leisure sector, with people staying at home in Australia as well. In terms of the airline sector, which has closed international flights and reduced domestic flights, as we saw yesterday, Qantas is standing down 2/3 of its workforce and talking with Woolworths to seek employment for them in the interval. The government support packages, importantly, are leaning into these specific sectors to support them during this difficult time. And we're working at a federal, state and territory government level, as well as key industry stakeholders and companies, to look at how we can assist both now and in the longer term. As you would have heard from Daniel, our China team is standing ready to support alongside the teams. Some of the simple things that we've done, I just want to make sure you're aware, we've updated our website regularly with insights on COVID-19 impacts by region and by sector. There's an update on China on that website currently. We're running webinars like this so that we can communicate with speed. We're pushing out information via social media like our China LinkedIn updates. We're ramping out our in-house e-commerce experts. We're talking to companies, industry associations, and so, for example, we've had a dedicated person there to help the seafood industry through this as well. I'd just like to finish up to say, keep the communication coming, keep reaching out through sessions like this. So thank you, ACBC. The China-Australia business relationship and connectivity remains of utmost importance, and we're here to help. Thank you.
Yeah, thanks for that update, Jenny. Okay, now we have about 13 minutes left. I'm receiving a few questions via email. If you'd like to send those in, that's james.scullin at acbc.com.au if anyone has any questions. So, Peter, my first series of questions, well, most questions rather, are for you. Now, I'll just put a few of them together. Someone is asking, how long is each individual affected for people who contract COVID-19? And do people get reinfected from the disease? Do we know that yet?
Yes, James, we know the incubation time is on average about 5-6 days, can be longer. So that's the time from exposure to actually developing symptoms. Now, the extent of symptoms varies greatly. The primary symptom to watch out for that we've been using for diagnosis and testing is 38 degrees centigrade temperature or thereabouts. But some people, we do believe, essentially are asymptomatic or have few symptoms, so they won't be sick at all. Now, most people are likely to feel ill, and then and then slowly get better. But some are experiencing a kind of second peak of disease. And that is what can be particularly dangerous in the elderly, that if you're sick, you feel rotten, you feel bad for a week or so, or 10 days, then you're starting to get better, then just take it easy, because there is a possibility of an exacerbation. Now, I don't know enough about it clinically. I'm not a clinical doctor, but I think that probably we're looking at a sort of a month-long period where anyone who thinks they've contracted this thing should take it relatively easy. Transmission time from an infected person, we think, is on the whole 14 days after onset of symptoms, which is why the 14-day isolation period has been imposed. But it's also the case that people who do get very ill may be ill for quite some time. So what we're looking at really is recovery rates, and some people who have been very sick have been on various types of clinical support for quite extended periods. But I can't answer the actual details of that.
Mm. So now that the pandemic is now that the COVID-19 is at the level of being a pandemic, and it's certainly gone global, do you think that we're seeing a coherent global strategy of countries cooperating with each other to deal with the global extent of the virus?
Well, again, my impression from the outside, of course, the World Health Organization is putting out recommendations, and that is our global organization. And we do have global networks like the World Health Organization Influenza Network, which is extremely good, and is the one that predicts the various influenza strains. So they're working hard on this. They're involved in COVID-19 as well as their usual business. Otherwise, it seems to me individual countries are doing what they think is best and learning from each other. And we all learned, of course, from the early Chinese experience. That's where it began. We've all learned from what happened in Italy, where things have been not good. And basically, we're adapting to the extent we can. Now, countries like ours have that capacity to respond. We worry particularly about countries that are poorer and have little public health resource, and that the danger that we will see major events in those countries. And I think we're starting to see some of that emerging.
Mm. Daniel, I think I've got a question here that for yourself. How is the spread of the disease in Australia being reported upon in China? And what is the feeling among Chinese about how Australia is dealing with the pandemic?
That's a tough question, James. I think we're pretty far down the list of considerations for the Chinese media at the moment. There's probably more reporting on US and Europe. In fact, there's a lot more reporting on the US and Europe because, in part, because there's been an exchange of words between the two governments in the US and China, which has sort of fueled their desire to pick apart the US response to the virus, and Europe because they're seeing scenes of what's happening in Italy and now in Spain, which is sort of creating some pretty terrible images that they're relating to here as well. I think there's a lot of focus on China now going out and helping the world. So there were those scenes of Chinese doctors and nurses being lauded through the streets of Milan in Italy, for example. In terms of Australia, not much. We copped some grief initially when the initial travel ban came in and when the level 4 travel advice was applied, but that seems to have dissipated now as the whole of the rest of the world has kind of followed that suit. Still some concern being expressed for Chinese students in particular and their capacity to get into the country, but again, that's dissipated largely with the declaration of this being a global pandemic by the WHO. So it's beyond that, there's not much reporting. The one thing that's got a lot of positive reporting, and I call out Peter here and his team in particular, is the breakthroughs that Australia has made with in relation to the virus. That has received significant reporting, not just through mainstream channels, but also through huge social media reach as well, which is terrific to see.
Okay, great. Thanks for that, Daniel. And Jenny, I have a question here for you. Why is Tourism Australia advising not to put out content on their WeChat channel? Despite this being a time when people can't come, it couldn't be more important to maintain engagement, and Chinese stuck in Australia waiting to come here, wanting to know if we still want them to.
So Tourism Australia doesn't come under me, so I probably can't comment on that, but I can go back and take that on notice as one of the questions for you.
Sure, no problem. Okay, let me just have a look. We have another question here. This is from Alex Harvey. Just a question for Daniel. What do you believe were the most effective measures taken by the Chinese government to restore the economy to normal capacity, and where is there room for improvement?
It's really hard to answer that. I think because it's not at normal yet. I think the shock to demand is still washing its way through the system, and it will be substantial. Those unemployment numbers are really scary. That unemployment jumped from 5.3 to 6.2% in a single month. And that's just the reported unemployment, of course, because there's a bunch of workers in the country who don't come into the official statistics, and they're being impacted by this too. So I don't think it is back to normal. I think they are, like always, the Chinese central government has laid down edicts rather than actually, presenting a singular approach to stimulus. So they've said you need to help regenerate, you provincial governments need to help regenerate economic activity in each of your provinces. And then each of the provinces have to balance that with the other edict, which says, and you will not allow COVID-19 to spread any further. And so they have to try and come up with these stimulus packages that actually don't undermine the health, the health requirements as well. I think some provinces are doing that pretty well. There was a report recently, Michelle Garneau, who runs the M on the Bund in Shanghai, for example, walked into work one day and found that her entire staff wages for the month had been deposited in her account by the Shanghai government, and that's sort of, no red tape, nothing along those lines. There are other reports, as I said in my talking points, that some of those red tapes, particularly for SMEs, are really, really profound. And so
Daniel, I've probably got another one for you, just quickly for 2 minutes. Can you give us a status update on the Australian Embassy's visa section in Beijing, and whether that's still receiving applications for visas, and whether there's some postponement period where visas can be kind of rolled over that have already been applied? Is there any insight you can give us to the status of the visa section there at the embassy?
So the visa section is still operating at the embassy. Obviously, there's not much demand if you can't get into the country. What I'd prefer to do is take it on notice, James, and get an answer from them directly around what they're doing, because I don't want to jump all over other people's toes. So perhaps if you can give me something, a written question, I can make sure that we get something sent to you to go up on the website in response to that. Would that be okay?
Yep, no worries. I'll pass that on. Okay, great. Well, we just have a few minutes left, so I think we should start to wind it up, knowing that everyone's particularly busy at this time. I'd like to thank all of our speakers, Professor Doherty, David Olsson, Daniel Boyer and Jenny West, for their insights today. Just to remind you again, this webinar has been recorded and will be available next week on ACBC and Austrade websites. Now, while many of you are enforcing social distancing and working remotely, ACBC continues to deliver our service to members. And hopefully on the screen, you can have a look at some of the initiatives we have coming up that David touched upon earlier. On Tuesday, the 24th of March, ACBC SA is delivering a webinar, The Road to Recovery, Doing Business in the Aftermath of the Coronavirus. We'll also be conducting webinars throughout the country from each respective ACBC branch with sector-specific guidance on how industry is dealing with the fallout and preparing for the rebound from COVID-19. We're also kicking off our ACBC courses program in mid-April, which is dedicated to engaging with regional Australia once tourism and education get kicking once again. We've also got our 2020 member survey that you can see on the website. I'll be doing more podcasts. We're doing a podcast on export market development grants. I'll be speaking with the Trade Minister and chatting with the Australian Open. And at long last, we'll also have a new website coming in May 2020. So there's a lot to look forward to at ACBC, but we understand it's a difficult time for people out there, and we endeavour to really provide you with as great a service and up-to-date information as we possibly can during this difficult time. So thanks a lot for everyone for tuning in today. Have a great weekend and stay safe, and remember to keep washing your hands. Thanks a lot, and we'll see you next time.